have Manshadi joining us from Manshadi Pharmacy. It's great to have you back on the show.
Thank you, Susan.
Yes,
how are you?
I'm well, thank you. Talking today a little bit about an ailment that a lot of people have had or will have at one point in their life, and that is athlete's foot.
Yes.
So we're going to talk a little bit about how do you get this? Where does it come from?
Sure. So it's not a very sexy subject, but we need to talk about it.
Yes.
You know, up to 70% of people during their lifetime, they get athlete foot. It's a very contagious fungus infection of the skin that will get it. And usually starts between the toes, and because it's nice, it's warm, sometimes unclean, and then it spreads to the entire foot and sometimes to the other part of the body as well too.
Mm-hmm. Is it a bacteria that grows in the skin?
It's a fungus. It's a fungus infection, and if it goes for long enough, it will peels, and maybe bacteria infection will go there as well too. Mm-hmm. But in the beginning, is most likely is a fungus infection that will start the process.
Okay, and so where is the most common places people will pick this up? I always hear public places. I remember as a child, my mom would never let me not wear slippers in a hotel room, or, you know, flip-flops at the public pool. Are these the places?
Yes, but also you don't have to, you also can have it with your own shoes. If you don't perhaps change your socks, you have to do it regularly. You have to do clean your you know, your feet, and dry your feet, especially between the toes and so forth. Yeah.
Yes.
So it's not only you get it from the public, but it's also we get it from our you know, sometimes not doing the things that we need to do on a daily basis, and we forget to wash those areas and dry them well, so we will get them. And you know, people that they work in the dust and construction worker, and people that they their shoes doesn't ventilate very well, they are most likely at risk. Also homeless people, you know, homeless people, they don't change their socks as often enough, or their underwear or so forth, and by not changing the socks, obviously will cause fungus infection.
I should have grabbed a couple of pictures to air of what athlete's foot looks like, but essentially it's red. Like what are the symptoms? It's itchy, it's red, what's going on?
Sometimes a lot of people have athlete foot and they don't even know it, because it's just maybe it's just peeling off. Some people, they have cracks on their soles, and they think, well, it's cracking, my foot is cracking, but they just put some moisturizer. However, it might be a fungus infection.
Right.
Sometimes it might be also, you know, the toenail starts to go yellow because it starts from the side of the nail, and then it goes to the toenail. So yeah, it starts from different areas and spreads.
Okay, and if you don't treat it properly, will it just spread even further? Could it go from your feet to your legs? Like,
very good question. Two things. I always would recommend to the patient minimum of 2 weeks to apply the fungus creams, but they should read the manufacturer's recommendation. But definitely 2 weeks up to a month, because it's embedded into the skin, so it takes time to get rid of it. As per your question that it goes above, yes, it can, you know, when people are changing their underwear, it may get to the underwear and goes and cause other infections such as jock itch and so forth, and it may get to the nail and different part of the body. Yes.
We have some prevention tips to help you stay away from getting into the situation of having this to begin with. So how to prevent athlete's foot? The first one, of course, you mentioned that washing between the toes is very important.
Correct, and dry them as well too after swimming or after showers. When you go to the public places or anywhere that you know you are have to have a bare feet, you may want to wear sandals. It's nice to wear a cotton or wool socks as opposed to synthetic socks.
Breathable, is that why?
Breathable, and then change it daily. Those are some of the important factors that we recommend.
Okay, and then the next board, I think that we have a few tips coming up here. So of course, breathable footwear, yeah.
That's right. That would be good. Something, and you know, some people that they sweat a lot, they should alternate their shoes. You know, one day wear these shoes and the next day wear the other shoes, so their shoes gets dried up. Maybe some people, they need to change their socks twice a day if they sweat twice a day if they sweat a lot. And also, you know, when your feet becomes a little bit itchy or you are not sure, please reach out to your healthcare professionals, your pharmacists, your doctors, and ask for help, and they are there to help you.
Absolutely. And then failing all else, of course, if you end up being diagnosed with a case of this, you can get an ointment or a cream to apply.
Correct. Most of this stuff are over the counter. You can just go to the pharmacy and ask for advice. Some of the nasty ones, we also have some prescriptions that they are stronger, and we can give. But don't wait too long, because the longer you wait, the worse it will get. And it will not go anywhere. It will be staying with us for a long, long time. There are a lot of remedies. Home remedies are out there as well too, but scientifically they are not proven to work. You can try it, but you know, vinegar, salt, yogurt, mustard oil, and so forth. However, you know, I think I will recommend to get the antifungal and
Why
apply
mess
it.
around, right? Why
apply
mess
it right
Get
away.
It done.
Yeah,
Absolutely.
get it done.
Is this something you're seeing a lot of right now, just quickly before we throw to a break?
I see it a lot
Yeah.
because people, they don't know they have it.
Sure.
They come in and they have a toenail problem and so forth. Many people, they should check between their toes, under their feet, and seek help if they're not sure.
Yeah.
Sometimes, sometimes they may not know that they have it.
Right.
Thickening of the skin also can be a sign of a fungus infection. So check it out, and especially if you are a diabetic, if you are have an autoimmune disorder and different condition, we need to attend to our feet on a regular basis. As we are taking shower, we should wash between our toes and dry it up after our shower.
Awesome. Misa, always a pleasure to have you on. Some great information here.
Thank you for having me.
All right,
again.
it's always a pleasure to have you on the show.
Thank you.
Information is right there. 2 locations to serve you, South Shore location and the North Shore. The phone numbers for both are on the screen. You can also look them up online, manshadipharmacy.com. We're back after a quick break. Stay with us.